And now I would like to introduce to you Dr. Susan Wyndham Bannister, President and CEO of Mass Life Sciences.
Hello, everyone. I'm really pleased to be here with you today, and the Life Sciences Center is very pleased to be one of the sponsors of the event this year. You've heard some very dramatic data by the speakers this morning. Again, in 2012 alone, it's estimated that about 242,000 men will be diagnosed with prostate cancer. Over 28,000 men will die of prostate cancer, and the disproportionate share of those men will be men of color. As an African-American woman who lost my favorite uncle to prostate cancer, these data are very close to home for me. The Massachusetts Life Sciences Center, on behalf of the Commonwealth of Massachusetts, is committed to supporting important ongoing research around the Commonwealth in order to accelerate the development and the commercialization of better diagnostics and treatments for prostate cancer. Again, we know that the diagnostics are as important as the treatment. Dr. Stern, and to all of the pioneers who were on the stage earlier, and to all of you who are doing great work in this area, I thank you. And I want to assure you that the state is your partner in this. And so what I would like to do is to share with you just a few examples of what Massachusetts is doing. I mean, you heard our legislators express their support, but let me give you some specific examples of how, with funding provided to us by the legislature, we are trying to make an impact. So in other words, how is Massachusetts walking the talk that you heard this morning? In 2011, the Massachusetts Life Sciences Center awarded the first $2 million of what is going to be a $10 million grant. You don't know what it's for yet. To establish a center for personalized cancer therapy on the campus of UMass Boston. This joint program involves Dana-Farber Cancer Institute and the Harvard Medical Cancer Institutes and Harvard Medical Centers, together with UMass Boston, to develop reliable and cost-effective tests to determine subtypes of common cancer. We talk about cancer as if it is really one disease. Many different types of cancers that have subtypes, different prognoses, and they respond differently to treatment. So the goal of this center is to allow physicians to prescribe treatments that are better adapted to each patient and each cancer and improve the chances of their recovery. An important goal of this center as well is to address racial, ethnic, and other disparities in cancer treatment through the advancement of personalized cancer therapies. In January 2012, the center awarded the Dana-Farber Cancer Institute a $10 million grant to support the expansion of its pioneering cancer imaging program. So this morning you've heard the importance of diagnostics, imaging, issues of disparities. This center that we're funding or partially funding for Dana-Farber is going to help Dana-Farber Cancer Institute's molecular cancer facility. This facility is going to allow physicians to better diagnose and characterize different types of cancers, choose targeted therapies, monitor the treatment effectively, and ultimately improve the outcomes for cancer patients. So in just the past year, on behalf of the Commonwealth of Massachusetts, we have invested $20 million just in the year in better diagnostics through imaging, through other types of precision tests and treatments. Now, the center is also providing funding to companies that are bringing these new therapies to the marketplace. We have funded a company that's based in Auburndale, Massachusetts. I want to say life sciences going on all around the state of Massachusetts, to continue their development of a biologic immunotherapy that uses a tumor-specific vaccine to fight the recurrence of cancer. And Advantigene is currently in phase 3 clinical trials. That means really close now to bringing this to market for the vaccine that is targeted to prostate cancer. So I think we can expect to see this on the market, we hope, in the very foreseeable future. And because of Massachusetts' commitment to the life sciences, the governor's commitment, the legislators' commitment, companies from all around the world, the giants in oncology, Pfizer, Novartis, Sanofi, H3 Biomedicine, are joining our efforts in expanding their presence here in Massachusetts. So like all of you, I look forward to the day when we will no longer need a Prostate Cancer Awareness Day. But until that day comes, please know that the Life Sciences Center and the Commonwealth of Massachusetts are working to fund the best research that's going on here in our wonderful and talented life sciences community. We are putting infrastructure in place to help us move closer to that goal. And with our sincerest thanks to the governor and to the legislature for their continued support, we are going to continue that work. Thank you.